There are five main senses which have been influencing our daily life, such as sight, sound, smell, taste, and touch. As for human beings, we use our eyes to observe the surroundings, ears to listen to music, nose to smell flavors, tongue to taste, hands to touch and feel. The intention of sensorial design is to establish the reputation of a product and redefine the appropriate methodologies to design fundamentally. The five senses are inevitable and play a big role through our daily lives. If we lose one of those senses, it will cause difficulties for human behavior, especially for those who is over 65. The percentage of humans using an aged care increases 10 to 15% annually. Recently, aged care has become a lot more common in Australia. In the environment of aged care, a sensorial design not only conveys emotional support, however, it also has emotional commitment and respect to living a better quality life. We begin with a sensorial stimulation. Developing a sense of inclusion within retirement home as avoid alienation and all of the negative consequences that come with that. Soon means the social environment depend education to close relatives. A village that invites family and children with more and further financial support.
Our bodies are in constant interaction with the environment, and thus architecture cannot simply address one sense, but rather all five. Through giving a space sensorial associations and emotions, a space will in turn project an aura. Oculocentrism is the privileging of vision over all other senses. Critiques of the oculocentric view highlight it as a source of disengagement to the real world, dulling down our core human emotions. In context, it is essential to avoid simply designing for the image, especially in the case of a retirement home where alienation is already a common theme. In the same topic, it is also essential to acknowledge that shape and surfaces pleasurable to the eye is still a part of good architecture. Similarly, use of lighting and shadows will enhance or de-enhance the living spaces. For example, spaces with lack of texture and diversity project blandness and little emotion to a room, in the same way that bright lights paralyze the imaginative mind. Now, sound is an unconscious background experience which develops a sense of connection, solidarity, and understanding of the spaces we dwell in, and smell awakens the forgotten images of our past. The reading places strong emphasis on touch, stating our skin reads texture, weight, density, and temperature. The experience of home is one of intimate warmth, and sensations of comfort have been instilled in us through pre-marital generational habits and lifestyles. If the entire body and its senses is acknowledged as one within our designs, then we can create a true, non-alienated dwelling for our elderly clients.
Dementia affects person's mental ability, which lead to forget something and having the experience problems. There's more than 353,000 of Australians with dementia right now. Within 5 years, the number will increase to 400,000. It's significant the importance of the dementia care. Dementia aged care community is like a retirement area. There are shuttle buses or delivery, which is cheaper than a dementia residence and can let people have the atmosphere of home. However, the residential area is restricted and need permission for entry and access. It's usually used when people are about to reach retirement age or in the early stage of dementia. In a residential facility, room types vary according to the demand of the care. Low demand for elderly dementia who is aggressive can take care of themselves, providing the public rest down with disability on cooking. Also, they have the public area for them to walk around. And for the high demand, they might be aggressive and may forget about how they used to live. Couldn't move, mostly need the wheelchair or the help from the nurse to move. Food-based tableware and other daily necessities are mainly plastic products, and they have drug control. There are doctors and nurses stationed. In the Aussie Care and Art Care Dementia Aged Care Center, their design mainly focusing on satisfying the unique requirements from people with dementia. For example, consider the position of the patterns or the decoration in the room. These varieties can let the patient get familiar with the space. or patients can have visitors or many friends, which reduce the effect of the loneliness.
After speaking to 3 elderly people, some who are in dementia facilities and some frail and depriving a sense, and their families about their experiences with aged care facilities, we found that mobility and health were the key factors for them to make the move into an aged care home. Common observations found amongst all 3 families was that the aged care facilities were very hospital-like. They had a clinical feel through long corridors, floor coverings, and fixtures. This clinical feeling made it very uninviting to families and visitors. It also made visits very stressful when grandchildren were coming to visit, as it is extremely boring for kids. This uninvited feeling the families got made visits hard and isolated the elderly person, as they felt like a burden. The current designs also seem to presume that aged care is a community living of those who require care, with large, beige-coloured, open-plan dining rooms and lounge areas. The families often believed these areas were more isolating and depressing, and that the residents often wanted their own personal space. All families interviewed agreed that instead of having aged care centres isolated, a broader community connection with schools and young people featuring playgrounds, low-impact sports centres and cafes is needed and will create a more welcoming and inclusive environment. Along with community connection, access to the outdoors, more natural light and greenery in aged care homes would decrease this sense of isolation, being locked up, and the typical hospital look most aged care homes adopt, and create a more welcoming, calming and pleasant environment for all to enjoy.